My name is Dr. Kirit Patel. I'm the chairman of the Department of Medicine and chairman of the Division of Cardiology at St. Joseph's Mercy, Oakland. Cardiogenic shock is a condition where patients' heart muscle becomes so weak that it is unable to supply enough blood to all the vital organs in the body, including the brain and the kidneys and other organs. And basically, that's the condition prior to dying, at least in situations where people have a heart attack.
Before I had my heart attack, I felt a heaviness in my chest. I sat on the edge of the bed, and that was it. It was very quick.
This gentleman, Scott, who is 52 years old, he presented to us with cardiogenic shock. Initially, he had a cardiac arrest, and they did CPR for 40 minutes on him. Fortunately for him, the CPR was done in time and adequately.
When I arrived here at St. Joe's, I had 200% blockages.
So they brought him to the emergency room. He was intubated in the emergency room. He had needed a lot of blood pressure medicine because his blood pressure was very low in the 50s and 60s when he came in. And as soon as they called us, we brought him to the cardiac catheterization laboratory, and we first put in the left-sided impala. After putting in the left-sided impala, and we opened up the artery, which was 100% blocked, now we see, in spite of opening up the artery, supporting the left ventricle, he still did not recover, and he continued to have a lot of arrhythmias, and he had to be shocked another 20 times, I think, and had CPR on the table. So after that, we put in a right-sided impala, which is the device that helps to pick up blood from the right side, the blue blood or the non-oxygenated blood, put it into the lungs, and from the lungs, that blood goes into the left side after it's been oxygenated, and the left-sided impala then puts it into the rest of the body, which is how our heart works. This situation is not common, where you have both the right and left ventricle failing. And till very recently, we had no devices for this. Most people who got into this situation did die. And now, with these devices that we have, the impala devices, which are a support system for the heart, basically it takes over the function of the heart.
The following day, they, I believe, took the pumps out, and my heart started pumping. If I didn't have those impala pumps, I don't think I'd be sitting here.
Till now, we really did not know how to use these impala pumps. So now we know, with the studies that we are doing in Detroit, which is headed by Dr. O'Neill from Henry Ford Hospital, that if we put impala pumps before we do any intervention, just to get the blood to different organs, the survival rate is much better. Hi there.
Hey.
Hi, how are you doing, Scott?
I'm doing well.
How is everything, all right?
I'm doing
You feeling
well.
good?
Yes. You know, I'm probably 95%, I would say, of 100.
There's about 50,000 patients a year that are in cardiogenic shock after a heart attack. So you can imagine if we made a 25% improvement in the technology, that means we have another additional 10,000 patients who are alive now. This is a living proof of how well this technology works.